Yeah, hi folks. Yes, the WHO has just launched a global digital health certificate for everyone who belongs to one of their member countries, which includes New Zealand. Now, this certificate will include vaccinations, routine immunisations and patient health records. And of course, if you don't comply, you can't travel. But first, our propaganda media celebrates UN-mandated refugee numbers.
For the first time in 3 years, New Zealand looks set to reach its full resettlement target of 1,500 refugees.
Yeah, now folks, I'm really quite confused about that number, as I always thought the refugee numbers were going up, but apparently not. Now folks, the following numbers come directly from the UN via the World Bank. Now I'll start with the most recent number, which is 1,794 in 2021, which sounds about right. But if we come back over here to 2003, you can see it's 5,796. Now, where did those people come from and where were they housed? And the same applies back in 1983 with 10,600. Again, where did they come from? Where were they housed? And it gets even worse, folks. In 1992, the number is 17,310. Something really stinks here. It really doesn't add up. The government is obviously lying to us.
The quota was increased from 1,000 in mid-2020, but COVID got in the way. As Nicole Bremner reports, things seem to be back on track as a milestone on the international refugee calendar looms.
Signs of home and signs of new beginnings. Optimism aplenty among refugees ready for a fresh start.
Our country is not safe.
Tough times in Indonesia left behind, Karula Zahidi and his brother are soon heading south.
I found the house. Next week I move from in here to Dunedin.
250 refugees from as far away as Iraq, Ethiopia and South America welcomed in a celebration ahead of World Refugee Day.
It demonstrates New Zealand's commitment to being a really good international humanitarian citizen.
Culture from the homes of refugees mixing with our own.
Yeah, by now they must be regretting coming here.
Picking up some new fans in the process. Interpreters ensured everyone followed proceedings. Ja Solis and his young family fled their native Colombia and sought asylum from Ecuador.
Our lives were in danger because we were threatened by armed groups in Colombia, and the situation was very, very bad and very dangerous.
They're now looking forward to settling in Nelson.
For my children and for my family, we're very happy to be here, and we want a safe and healthy future for them.
The UN's local representative says New Zealand's work is vital.
Oh, that makes it all okay then. To be controlled by the UN is so good.
I think in New Zealand you have some gold standard settlement programs here.
And for the first time since boosting the refugee quota in the midst of COVID 3 years ago, it looks like the country's on track to reach it. With this year's arrivals already at 1,490, there's an expectation we'll meet the 1,500 target by the time World Refugee Day arrives on Tuesday. It's a lot to take in, today's ceremony moving some to tears, with others celebrating a new beginning.
And the indoctrination begins.
It's a great pleasure to be part of the signing ceremony for the WHO Global Digital Health Certification Network uptake ceremony. A warm welcome specifically to our European Commissioner for Health and Food Safety, Mrs. Stella Kyriakides. A warm welcome also to Ms. Sandra Gallina, Director General DG Santé, and her team. We have with us from WHO side our Director General, Dr. Tedros Adhanom Ghebreyesus, and our Chef de Cabinet, Razia Pense. I think without further ado, I would like to give the floor for introductory remarks to Dr. Tedros. Please, Dr. Tedros, you have the floor.
Thank you, Katerina. Your Excellency, Commissioner Stella Kyriakides, and Director General Sandra Gallina, dear colleagues and friends. Thank you for joining us today, and I also acknowledge Commissioner Thierry Breton and Director General Roberto Viola, who could unfortunately not be with us today. The COVID-19 pandemic highlighted the value of digital health solutions in facilitating access to health services. While the emergency phase of the COVID-19 pandemic is now over, investments in digital infrastructure remain an important resource for health systems and for economies and societies at large. Like many countries, the European Union made significant investments in COVID-19 certificates to help people move around as safely as possible during the pandemic. The European Union's certification system was used by all 27 EU member states and more than 50 other countries. Building on the success of the EU system, WHO is proud today to launch the Global Digital Health Certification Network. So thank you so much to European Union for the excellent certification system that you have transferred to us, and we have the chance to build on it. WHO will begin operations of the network today with the existing COVID-19 certificate as a global public good.
A global public good.
Soon after, we will expand this infrastructure by incorporating other use, such as a digitized international certificate of vaccination,
Digitized international certificate of vaccination,
routine immunization cards,
routine immunization cards,
and international patient summaries.
international patient summaries.
WHO will continue to work with all regions to ensure that the network is accessible globally, incorporating relevant experiences and standards from other countries and regions. It's important to emphasize that privacy is key. WHO will not have any access to any personal health data. We will only maintain a directory of the public keys that can be used to verify the authenticity of a member state's digital health records. The Global Digital Health Certification Network will be an important part of our efforts to strengthen health systems and support our member states to prepare better for the next epidemic.
Yes, so in other words, to stop non-compliers from travelling.
Or pandemic. The network could also play a crucial role in cross-border humanitarian situations by ensuring people have access to their health records and credentials as they move across borders due to conflict, the climate crisis.
The climate crisis, the newly manufactured wave of refugees.
And other emergencies. WHO would like to thank again the European Commission for its partnership and support, and for advocating the EU member states and other participants that they migrate to the WHO network. I also thank the EU and WHO teams who worked hard to bring us to this moment. We very much value the European Commission's technical and financial support, and we very much hope that support will continue. WHO looks forward to implementing this administrative arrangement and furthering our collaboration so that all member states can equitably reap the benefits of this vital digital public infrastructure. I thank you, and Katarina, back to you.
Yeah, now folks, who would have thought that getting into bed with a global communist organisation was a bad idea? That it would end up controlling everyone on the globe? Who would have thought that? Yes, our naive politicians have a lot to answer for. Anyway, folks, I've posted all the relevant links below.